Hey everyone, this is Susan with NRSNG. Today we will be working through a care plan on pneumonia. To see our massive free database of nursing care plans, just visit nrsng.com/nursing care plans, all lowercase. You can also download our free editable PDF care plan template that I'm using at nrsng.com/care plan template, also all lowercase. So let's get started. The first thing about pneumonia is that it could be caused by viral or bacterial, but I do want to make this differentiation. Once your lungs are filled with fluid, you're going to have bacterial issues. So we always treat pneumonia with antibiotics. So let's get into the care plan. My first nursing diagnosis is impaired gas exchange related to decreased lung surface availability as evidenced by shortness of breath and shallow breathing. So there's fluids filling up their lungs. Their lungs are not going to be able to exchange the gas the way that they were before. So they're going to have low oxygen levels or lower oxygen levels than they normally would. And they are going to be breathing much more shallowly because their lungs are filled with this fluid. The second nursing diagnosis I put is ineffective thermoregulation related to infection as evidenced by febrile body response. So our body knows that it should not have fluid in the lungs. So it's going to send out its troops and try and fix the problem that we have by raising the body temperature enough to kill the invasive species that's coming in there. So you're going to be dealing with someone continuously having, fever, and then you got to bring it down, and it's going to be a back and forth seesaw for that. The third nursing diagnosis is impaired tissue integrity related to decreased oxygenation capability as evidenced by decreased O2/possible hypoxia. So if you aren't getting the oxygen in because your gas exchange is impaired, you are going to not be able to perfuse out to your body the potential or the proper amounts of oxygen. And when you don't have the proper amounts of oxygen, it impairs your tissue integrity. So we want to make sure that that we take extra good care of their skin. So for our goals, our first patient goal is to maintain oxygen levels and an effective breathing pattern. That seems like the most obvious patient goal for our patients. We are going to do that by monitoring their oxygen saturation with a pulse ox. And another way you can do it is through lab work, so getting blood gases. This could be a venous blood gas or an arterial blood gas. It depends on what you're trying to look at. You want to encourage the patient to cough and to clear their airway, to continually get that crud out of their lungs if they are able to. And then, of course, if they're hypoxic, you want to bring or administer oxygen. So we could do nasal cannula. We could do it by mask. We could even give them breathing treatments to try and open up their lungs a little bit to increase the surface area for them to receive the oxygen. Yes, we're going to implement that plan, and we will evaluate it by their oxygen saturation maintenance. You will look at their skin will be normal for race, pink, warm, dry, things like that. So monitoring their skin, monitoring their oxygen saturation, and also monitoring their breathing. It's going to be tough to breathe regularly when your lungs are filled with fluid, but your body won't be reacting quite as difficult if it has what it has, the nutrients that it's supposed to have, or the oxygen that it's supposed to have. So for our second patient goal, I put follow antibiotic plan and administration exactly as prescribed. So, or any sort of medication regimen that this patient would need to be on, but specifically the antibiotics. So we tend to do like vancomycin is a very common pneumonia antibiotic, and so if they're in the hospital, it'll be IV vancomycin, which of course we want to watch out for Redmond syndrome. So this is something that you infuse slowly. Another one that we would give commonly is Zosyn for pneumonia, or it's also called piperacillin / tazoin or something along those lines. So we are going to, our rationale and our intervention is obtain cultures, specifically blood cultures, prior to administration of antibiotics. Someone with pneumonia may have enough crud in their lungs that they'd want a respiratory culture, and it also depends on the situation as to whether they order a respiratory culture, but you want to obtain those cultures before you start the antibiotics, because if you start antibiotics, it's going to change the makeup of that bacteria, and you aren't going to be able to effectively get down to its specific type. Is it gram negative, gram positive? What kind of antibiotic do you need? So administering your antibiotics exactly on time is super important for these patients, and making sure that everything is scheduled exactly as it's supposed to go. Yes, we're going to implement that. And the evaluation outcome will be that it will be a decrease in the infection and decrease in the infection signs and symptoms. So they're going to start feeling better once the antibiotics start to do their job. The third patient goal is prevent the spread of infection. We're going to do that through education, and this is like a strong suit for nursing. So hand hygiene. We are going to not only wash our own hands and wear the proper PPE in these patients' rooms, but we're going to teach them about their own hand hygiene, washing their own hands, using hand sanitizer, coughing in their arm, covering their cough, or making sure that they're not breathing over people, staying away from other sick people. Like, we don't want to have them bring their granddaughter in to visit, the infant granddaughter, and have them visit while the grandma is sick. Yes, we're going to implement that. And we will evaluate this by a verbal readback. Hey, do you understand what I'm saying? What is it that I'm saying? And they will read back. As soon as they read back, they tend to know it better. It's one of my favorite styles of getting the patient engaged. And then also a physical demonstration. Have them actually do what you're asking them to do. Watch them wash their hands. Make sure that you see them use the hand sanitizer. Watch them cough in the crook of their elbow. So that was the nursing care plan on pneumonia. Thanks, guys.
Visit nrsng.com/nursing care plans for our huge free care plan database, and nrsng.com/care plan template for our editable care plan template PDF. This has been another episode of the NRSNG podcast. Thank you for joining us, and thanks for being a part of the NRSNG family. Now, go out and be your best self today.